Hello and welcome. I am Dr. Anil Joshi. Welcomes you to my series Learn Radiology with Dr. Anil Joshi. Today's topic is based on radio physics, that is MRI physics. In particular, we are going to see MRI spectroscopy, how it is done, what are its role, how it gives the readings, which sequences are used by the machine or by the machine operator we are going to see in this machine, so also its clinical applications. But before starting, disclaimer and disclosures. For this lecture, we have used material which is going on in our department for many years. However, some of it is from the net, but we have confirmed that it is royalty free. However, still we thank all of them from where we have got this. With this brief disclosure and acknowledgement, let's get going to the topic, that is spectroscopy, MR spectroscopy, magnetic resonance spectroscopy. Now, it's a non-invasive diagnostic test for measuring biochemical changes in the brain, especially the presence of tumor. So, what is the prerequisite? There has to be certain biochemical changes, and two, there has to be certain pathologies. Now, each pathology produces different type of biochemical changes. So, it will have different type of metabolites, and these metabolites, if MRI can pick, we can get idea about what that lesion is, especially when it is a tumor. While magnetic resonance imaging identifies the anatomical location of a tumor, MR spectroscopy compare the chemical constitution of a normal brain with normal tumor tissues to know what these lesions are, what the pathologies are. This can also be used for detecting changes in stroke or in epilepsy. So, not only in malignancy, what we will see is in encephalopathies also it is used, in benign lesion like meningioma also they are used. So, lot of applications and specific. How does M.R.S spectroscopy work? M.R. spectroscopy is conducted on the same machine as conventional MRI. The M.R.S scan uses a powerful magnet, then radio waves, RF waves, and computer to create an image of the pathology as well as normal tissues. So, there is nothing different. This has to be performed before doing spectroscopy, but it is just a brief mention. Now, after the test is complete, MR spectroscopy can be performed, which are series of tests that are added to MRI scan of brain spine to measure the chemical metabolism of the suspected tumor, or let us call suspected lesion. It can be tumor or even otherwise. MR spectroscopy analyzes the molecules such as hydrogen ions or protons. That is a standard MRI description how MRI works. Now, proton spectroscopy is more commonly used. There are several different metabolites or product of metabolism that can be measured to differentiate between a tumor, their subtypes, or something like suspected recurrence also, whether tumor is recurrence or not, there is the recurrence or not. Now, what is detected? Amino acids, lipids, lactate, alanine, then N-acetyl asparatate, then choline and creatinine. Myoinositol is also detected. It has got specific application which we are going to see subsequently in this lecture. The frequency of this metabolite is measured in units called as ppm, particle per million, and plotted on a graph or as peak of varying height by measuring each metabolites ppm, that is parts per million, and compare it to the brain tissues. The radiologist can determine the types of the tissues present seeing the metabolites. MR spectroscopy used to determine the tumor type and aggressiveness and distinguish between tumor, recurrence and radiation necrosis. Different metabolites can indicate possibility of glioma, that is lower than normal, N-acetyl asparatate, then elevated choline and lipid levels, and lactate peaks. That will give you idea that you are dealing with a glioma. Then radiation necrosis does not have elevated choline levels. Then meningiomas, elevated alanine levels. So not only in malignant but also in a benign lesion it is useful. A technologist will perform. Now how the test is done, as I told you, it's just an extended part of routine MRI. Now extensively we have covered all these things in some other lectures. Please visit our website to know how a routine MRI test is performed, what are the prerequisites, how you have to prepare, but let's have a summary of it. Now you will have to go to radiology department, same as that you go for a routine MRI. You will not feel a difference whether M.R.S is done or routine MRI is done. Then there is preparation of patient. Then again we ask patient to wear either comfortable clothes or we give gowns from our department, and he has to come at least 30 minutes before the procedure so that he will be comfortable. Then what should be avoided? Jewelries, metals and credit cards. Mobile should not be taken inside, otherwise they will start getting malfunctioning. Now patient will lie on the table, you know it, cradle, we have shown it in earlier lectures also, and a scan is done by keeping head in headrest and arm by side. The additional device like coils are kept depending on the part to be imaged or part to be examined. There are different coils for different organs which are specialized and they are used for these purposes. That is same as what we are talking about doing a MRI scan to start with. Now patient will have to hear multiple sounds, then multiple vibrations. Sometimes patient use earbuds so that the sound will be less, but all these things are below the tolerance limit. You will not have any trouble with it, but you will have to get used to it in earlier few minutes. We have made a video in which we have shown how the MRI sound comes and how to protect it, how to overcome fear of claustrophobia. Now this is in different lecture we have covered. Do visit to it so that you will be mentally strong before going to MRI suite and you will not have any trouble. Your examination will go unnoticed. Otherwise the examination, which should not take more than 10 to 15 minutes, may take half an hour or more. If you move, a sequence has to be repeated. There are multiple sequences and each sequence takes minutes. So ultimately it pile up to delay of 15 to 20 minutes. So as far as possible patient should cooperate. There should not be repetition. All the sequences can be taken and MRI examination can be done faster. Now MRI and MRI spectroscopy are extremely safe. There is no additional risk to the M.R.S after MRI is done. There are no known health risks associated with magnetic field or radio waves used for the machines. They are absolute operate in a health limits. Some people are sensitive to contrast. Again it is covered in some different topic. Do visit our website. There are extensive lecture on contrast, CT contrast, MRI contrast, old time, that is ionic, non-ionic contrast, what are the side effects, how to avoid them, how to treat them, how to know them. When you know patient is having reactions, please visit our website. It has given all these things in extensively detail but in different lectures. It is most important thing you should know. All the drugs are FDA approved. So there is a restriction on any pharmaceutical company to have a safety limit for the drugs, and unless the multiple trials are conducted, it will not come to clinical practice. Now when you do not use MRI, it is same contraindication that of the earlier MRI lectures. Cardiac pacemaker, artificial valves, metal plates, pins, implants, then intrauterine devices. Sometimes even a dental filling can also disturb. It can cause artifacts. Now insulin pumps, then aneurysmal clips, all these things, gunshot injury, then cochlear implant, all these things are extensively covered because they are common to all MRI test and MRI lectures. So this is same as all. Do visit our website, do see other lectures also in which we are given all these things, and how we test them is we have got a metal detector and we move it over the body and know whether these things are there or not. But anyway, it is your duty to tell patient. Then preparation of patient, any metallic substance on body should not be kept, no ornaments, no credit card, all things has to be kept outside, otherwise you will find that they are inactivated or they are not working properly, they are malfunctioning. Pregnancy should be informed because of the slight different rules in different countries. In United States, they do not allow, or the MRI in first trimester is not allowed. However, to our knowledge, to our reading, there are no papers, there are no established statistical data which has proved any abnormalities or any effects on the fetus during the first trimester by the MRI. However, a due precaution has to be taken, rules has to be followed. MRI can be safely performed in second and third trimester. There is no harm. Often it is one of the investigation of choice for an anomaly scan which is done in between 20 to 24 weeks. It can detect excellently all anomalies. Again, it's a topic of different lecture. Then you will need to obtain a written consent. You have to give a consent. It is everywhere for all medical tests and all medical hospital, a written consent, because a radiologist, a radiology technician has to tell you all the advantages, disadvantages, risk involved and the laws pertaining to it. Then only you can accept it and give a consent. Now let's go to the physics of MR spectroscopy. Multi-voxel M.R.S. was done and water separation was achieved with a chemical shift by selecting a technique. Now these are all techniques I have given, it is highly technical. You can have a look at it, pause it. It will give you a more detail as far as the metabolites and the sequences are concerned. With that, we'll go to the another slide. Now here again it gives more details about the sequences and the adjustment you will have to make on machines. These are required. Those who are interested can pause it and read it. They are important, but not for all those who want to know it as the clinical point of view. So let's go to clinical point of view. What is the role of MR spectroscopy? But physics is important because unless you obtain a proper scan, proper graph, a radiologist cannot interpret. So the peak ratios can be obtained by measuring and comparing areas under the curve. The peak are assessed as follows. Now here we are given the scales, how the peak are read and how they come on the graph. Now interpretation is important. All MR images are evaluated by a specialist radiologist in neuroimaging. Now what he does, he blends the clinical data and then concentrate on MRI findings. Most of the time what your patient has got clinical details, what a clinician suspect, what a earlier test says are with the patient, so they needs to be given to the radiologist so that he can give you a more accurate diagnosis. Now evaluation of DWI with ADC values calculation and analysis of MRS peaks and ratios from the all studies, lesions and from the areas outside the lesion margins at the edema, etc. is a technical skill and a technologist must know from where to take the readings. Now, biopsy with the histopathology results or the clinical diagnosis are a gold standard. Histopathology is a gold standard. What M.R.S. does is it tries to avoid the biopsies, or it tries to take a clinician as much near the diagnosis as possible, especially if you are dealing with the malignancies. So histopathologies are important. Clinical details are important, but what M.R.S does is it reduces the biopsies, number one, and second thing, it helps clinician to know preoperatively if it is a glioma, that how he has to be prepared and what are the subcategories of that. Now, statistic is extremely important as far as MRI spectroscopy is concerned. Statistically, the values are calculated and they evaluate by utilizing M.R.S and DWI with ADC values measured in the diagnosis of multiple brain focal lesions. This data entry and analysis were done by using statistical programs which are available ready-made on the computers. Now these are the graph, how you acquire it. You acquire a graph like this. Now you have got on one axis, that is the concentration, and another particle per million. So choline, creatinine and NAA are the important metabolites, but other are also important, but these three are maximum important. Now this can identify concentration of metabolites in the tissues. So this is the advantage of M.R.S. It is additive test for the routine MRI, so nothing special, just after the MRI you are performing it. What are the disadvantages? Low resolution, then very susceptible to local magnetic field heterogeneity. So minor artifact can disturb it. This is very noticeable when imaging close to the bone, calcium and blood streaming. So you have to be very careful in getting the graph and interpreting them. Most of the time you will not get a homogeneous magnetization in that area. So, and another disadvantage, it can be applied to very limited thing, but wherever it is applicable, it works. Now, detail about voxels we have discussed in some other lecture. Do visit it. The M.R.S can be a single voxel or multivoxel. We are going to discuss the advantages and disadvantages of single voxel versus multivoxel. Then single voxel has got certain advantages, certain disadvantages. So also for the multivoxel, we'll see them subsequently. Now we are single voxel. It has got high signal to noise ratio, no spectral contaminations, short scanning time. Disadvantages, it has a very small coverage and it has low resolution. So we have to go to multivoxel chemical shift imaging. Multivoxel, that is 1D, 2D, 3D array are selected, spectrum is produced for each voxel. Now advantages are larger area can be covered, higher resolution can be achieved, longer imaging time can be achieved, more likely to have magnetic field in homogeneities. Then it has got lower signal to noise ratio. These are the disadvantages of multi-voxel chemical shift. Then spectral contaminations from adjacent voxel is possible because it is not a single voxel, you are considering many voxels together. Most common metabolites detected and their chemical relevance are outlined here. What this table says, on the extreme left there are short forms myo, inositol, ML, choline, CHO, creatinine, CR and GLX, MEX, GABA, glutamine and glutaminate. Now then are the frequencies ppm 3.6 to 2.1, then their role in glial markers, cell membrane and metabolism, energy metabolism markers and intracellular neuronal transmitters in GABA. Clinical implementation of these are in the last column, that is a clinical relevance. Raised in gliomas, then multiple sclerosis reduced, also in hepatic encephalopathies, raised in tumors and demyelination. Then creatinine is constant peak and GLX is raised in hepatic encephalopathies. To add a few more, lactate is called LSC, then there is a concentration, ppm, then there is where you get it, and last is in which disease it is raised. Lactate in ischemic seizures, tumors, then mitochondrial disorders, LIP in raised in necrotic tumors, and amino acids in raised in pyogenic abscesses. Which are the sequences we use? One thing is suppressed water signal. Water contains a large quantity of hydrogen nuclei, which makes the small spectroscopic signals more metabolites. It is usually done with a chemical shift select, that is CHA sequence, which saturates out the water signals to select voxel or voxels of the interest. With SVS, this is done with the successive RF impulses in 3 orthogonal planes which intersects at the voxel of interest. And with CSI, phase coding steps are used to image multiple voxel. Then is the acquired spectrum. Serial sequences can be used to acquire the spectrum, including point resolution spectrum, that is PRESS, and stimulated echo acquisition mode, that is STEAM. These are the short forms of the mode. Now, what is the take home message? After all this short lecture or long lecture, whatever you call, after a lot of knowledge you have gained now, you have seen how the metabolites can talk about the pathology. Now, M.R.S. utilizes different Laramore frequencies based on metabolic compositions. Most often uses protons, but because they are ample in body, but also can use carbon and phosphorus. Forms spectrum of frequencies present and strength of the signals, that is concentrates. Then M.R.S. is also resolution and very susceptible to local magnetic field in homogeneities. So homogeneous magnetic field, a magnetic field free of artifacts is prerequisite for M.R.S. Then it can suppress water signal. Then CHESS is a sequence use because we need to suppress water, and a very high proton content in water makes otherwise weaker signals. Then we have got two different technique, a single voxel, quicker, better signal to noise ratio, and multivoxel, better resolution, image larger. But since you have got multiple voxel, there can be multiple voxel of slightly different readings, so that is likely to be with a multivoxel, but it will have better resolution. Then acquire spectrum, that is PRESS and STEM, most commonly used. We have seen just now what they are. So with that, we are coming to end of lecture. I thank you for giving me your valuable time. In this lecture, we have seen how an investigation called spectroscopy, which is done at the end of MRI, helps us by knowing the metabolites, what are the disease patterns, what are the diseases, or it can even give us a good idea about the gliomas. I thank you. I request you to visit my website. I request you, if you like the lecture, give us a thumbs up, and we'll meet in next lecture. Thank you, goodbye, and take care.